Diagnostics all happening on one platform and very simple to use. There are very few companies which are right now in this process, but there are very good chemists and there are very good immunologists here in India and specifically in the state of Andhra Pradesh, and their skills can be leveraged to produce these technologies. There is one platform called Fluxurgy which is in this space. The third trend is obviously looking at alternate sample types. There are newer samples like urine for tuberculosis and tongue swabs for tuberculosis which are now becoming available. They're easier to collect and obviously easier for the diagnostics to be implemented at field level. The fourth point which I wanted to mention, which you specifically asked about the market entry, is the biggest valley of death is that technology becoming available and it not getting to the masses. So I think it is, I've been hearing since morning that there's going to be a lot of focus on last mile access. Yeah. I think it is extremely critical, for the states to be able to work with these developers in order to make sure that there are mechanisms that are put into place so that these technologies can reach the people who need them the most and at scale. And it is great to see that the state of Andhra Pradesh, under the leadership of Honorable CM, has announced Anantapur as a proof of concept. So these technologies can actually be tested at a proof of concept level and then potentially be scaled up.
Thank you, Dr. Sarin. Dr. Praniti Reddy, we heard today about the state's priorities on cancers, particularly breast and cervical cancer. We also know women's health is at the front and center of the health department's goals. We heard from Krishna Babu Garu actually highlight that. As a world-renowned OBGYN and director of Rainbow Hospitals, how are you already using AIM Deep Tech and what opportunities do you see for the private sector?
So I am from the area of maternal health and it was very interesting to see your presentation, sir. First of all, I would like to congratulate the state of Andhra Pradesh that you have already reached a maternal mortality goal which is far lesser than the SDG expected goal, and you've set for yourself a target which is very ambitious. You want to reach below 5, and I think to reach that below 5 will need a lot of hard work. It's a bit like weight loss. You can lose the first 10 kgs very easily. When you come to the next 10 kg, it's the stagnation. And I think as a specialty, maternal health care lends itself extremely well to technology. It lends itself extremely well to technology because it's a very structured journey that a pregnant woman follows. 95% of the pregnant women go through a very structured journey. The interventions are very structured. They're extremely predictable. Right now, what is happening is that the focus is entirely on what is going to happen during childbirth, how we can reduce maternal mortality during the process of birth itself. And that is, in terms of institutional deliveries and having midwifery-led care. But I think the focus now and what technology will lend itself to should go on to the antenatal care that we are providing for women, because it can be extremely structured and technology can come in very well at this point. And because if you pay attention to the antenatal journey of the woman, you're going to create a woman who's strong mentally, who's strong physically, and who will have less risk of dying during childbirth. While childbirth is a critical period in the journey of pregnancy, it's a very small, the penultimate lap that somebody has to run to go through that process. So technology will play a big role in terms of not just telehealth. Right now we have women coming for about 15 to 16 visits during pregnancy, and that's redundant. It becomes a big roadblock. They should not really need to come to the hospital more than 3 times during pregnancy, and the rest can be taken over by telehealth. And by telehealth, I just don't mean teleconsultations. I think in the field of pregnancy and childbirth, education plays a big role. And I think technology should be leveraged to educate not just women. I think at this point, reducing maternal mortality should shift to families and communities also, the responsibility. So I think it should be a community goal to ensure that no pregnant woman suffers any complication. We also have a number of AI systems which we are using right now to risk stratify women at very early stages in pregnancy. So by the end of the 8th week, before even the 3rd month, we can risk stratify and say which woman can develop preeclampsia, which woman can develop heart disease, which woman can die because of bleeding. And I would envisage a time, sir, where no pregnant woman should ring at 3 a.m. and say she has palpitations. We should know at the onset of pregnancy which woman can have palpitations and prevent them before they occur. And building women antenatally, making them strong mentally and physically, is not just going to reduce death in childbirth. It should simply reduce the risk of death in childbirth. And that will happen by leveraging technology to spread education. And education is the single most important thing. And antenatal visits now have become about eating iron, calcium and taking tetanus injections. And that should not be the focus of antenatal care. It should become a way of life. Pregnancy,
Thank
that
you.
9 months
Thank you.
should be a way of life.
Thank you, Dr. Reddy. Thank you for eloquently expressing what's available right now in the AI. Amit, I know you for many years now, maybe 15 years or so, and your deep work in AP and financing, health sector reforms. So can you speak to this audience about what's the next movement for the bank, especially in this particular area of AI and deep tech?
Thanks, Angela. So let me first acknowledge, the kind of health outcomes the state has achieved in terms of your, maternal mortality, neonatal mortality, and so on, has been pretty good. And this is as a result of the outputs which we see in terms of the improved immunization and the institutional deliveries. And all this have been driven through the kind of investment the state has put in the human resource for health. AP is the only state in country which has less than 5% vacant position of specialist, which no other states could achieve. Your health infrastructure has been significant in terms of the access. 3, the kind of data or the digital interventions which we see is tremendous, and Krishna Babu sir has already put the numbers very clearly. So these are like few very clear outcomes which one can see. However, the challenge is we have solved for the access, but the quality still continues to be the issue. And the majority of the deaths which are happening are largely because of poor quality of service. So that is something which one has to look at very carefully. The other challenges are also being related to, your communicable disease like TB. The numbers still continues to be the high. The number of C-sections and the teenage pregnancies and the adolescent health is also a larger problem. And until unless we try to resolve that, I don't think so we are going to really achieve what we want to achieve. Before I close, there are a couple of just 2 points which are very important. Again, the health insurance program in state is pretty old, but it's not the coverage which is important. It is the effective coverage which is very important. And when I say effective coverage, probably even if you are able to look at access to a comprehensive care package, which can ensure reduction in out-of-pocket expenditure. So let's maintain up to 20%. That would still be a good deal in terms of looking at the overall thing. Second point is the epidemiological and demographic transition, which is beyond our control right now, have posed several challenges. Now, whether it is in terms of your aging population, your non-communicable diseases is still not being controlled. And there are interventions which are outside health, as Dinesh rightly mentioned, need to be handled carefully.
Thank you. Thank you so much. Dr. Sanjay, I call you here for 2 reasons. One is that you lead the Axel Priest School of Public Health, and you also have a school on AI and robotics that I want everyone to hear about. So I want to know about the collaboration between the School of Public Health and the School of AI and Robotics. And second, I know that you have a special invitation for everyone here, so the floor is yours.
Thank you. I'll explain the philosophy behind why we have 2 schools. I think every university has a unique opportunity to create an ecosystem, because university is basically a universal knowledge hub. How do you ensure that there's a cooperation, there's a philosophy behind it? See, the training programs are sectoral, but the problems are intersectoral. We need to really think about our education system Are we doing intersectoral programs, or are we still being a silo in sectoral programs? Policies are mostly sectoral, but the problems are intersectoral. Then again, policies are national, but the problems are international. So intersectorality in education and research is extremely important. This is the philosophy behind. At NIMS University, we have Institute of AI, Robotics and Cybernetics. In the same campus, we have a medical school and we have a public health. The message here is very clear. When you talk about AI, there's a triangle which influences the way you work on. One is security, the other one is privacy, and the third component is business. So how do you balance this triad becomes extremely important. So one message I have, to the Andhra Pradesh, which is doing extremely good. I'm extremely happy here listening to all the developments. My only request is, if we can invest on primordial prevention more, because by doing this, you are actually intervening before the emergence of risk factors. So we have to deal with unknown unknowns. Right now we are doing good in known knowns, known unknowns, but the future is unknown unknowns. So you need thinkers and implementers in this area.
Thank you so much. And what about the special invitation?
Yeah, this special request to the Honorable Chief Minister, sir. Sir, NIMS University has taken the lead to host the World Health Summit regional meeting in New Delhi. World Health Summit is happening in Berlin since 2009, but this is the first time in India. It will be hosted at Bharat Mandapam from April 25th to 27th. What I told Berlin team was a very bold statement. I said, you have a history, but we will create a history. Sir, please accept our invitation as guest of honor. I know we'll be very happy, sir, with the developments, with the case studies, because the regional initiatives which we start have a global impact. But nowhere, because as Indians, we are very nice people. We don't speak much, but we do a lot. Sir, please accept the invitations. Thank you, sir.
Thank you very much, Dr. Sanjay. Before we move on, I'd like to invite Ms. Vinutna, the Assistant Collector of Anantapur, who has actually started using the virtual PMU already to draw some conclusions of her own. So if you could quickly come up to the dais, because we've been told we're really running out of time. Thank you so much.
Good afternoon to Honorable CM Sir, Honorable State Ministers, respected Chief Secretary Sir, all the respected seniors and august audience present here. I am Vinutna IAS 2023 batch, Assistant Collector Anantapur. Sir, as an aspirant preparing for the civil services exam, healthcare is always an area of deep interest. Now, after 7 months of entering into the service, it has become real, and I realized the crucial role healthcare plays in governance. It is a matter of immense pride and with deep gratitude, I stand here today to share with you all the pilot data analysis project we are working on in Kuderu Mandal of our district Ananthapuram, in collaboration with the Swasti team and under the guidance of our district collector, sir. As a part of the vision of our Honorable Chief Minister, sir, in line with the Vikasit Andhra Pradesh 2047 and also Vikasit Ananthapuram 2047, out of several others, 2 of the major targets we have chosen include from 23 per 1 lakh live births of maternal mortality rate as per NFHS 5, we want to bring it down to 0 and reduce the anemia incidence percentage from 57 to less than 1% and intensity level in a targeted manner from severe to moderate to mild. Aligning with these thoughts of the district administration, Swasti team had come to Ananthapuram, coupling with their concepts of precision action for the climate health and virtual PMU, we worked extensively on data and came up with a pilot Swarna Ananthapuramu analytical dashboard. So as mentioned by our Honorable Health Minister, sir, re-emphasized by the Secretary Health, sir, we have humongous data being collected on a daily basis at our PHCs, sub-centers in India. Andhra Pradesh stands first in place in terms of electronic health records data. Swarna Anantapuram is one such data analytics dashboard platform that aims to put this data to right use for the larger public good. For doing this project, sir, we have chosen a PHC in Kudiru Mandal of the district, which is catering to 40,000 population, and that is receiving 100 to 150 cases every day. So these are the objectives, sir, which we aim to achieve using this platform, Swarna Anantapuram. One is data triangulation. First, we have different sources of data. We want to bring it all to one place. Comprehensive and advanced analysis. We have realized that, sir, we need a life cycle approach. There are so many forward and backward linkages. Maternal mortality is not exclusively maternal mortality. There's also forward linkage to it, and there's also backward linkage to it. So we have to do comprehensive and advanced data analysis, and this will aid us in evidence-based decision making. And also this dashboard aims in addressing the issues at the right levels and timely escalations whenever needed. So what is, next slide. What is the methodology we have adopted is the given below. One is, first we have reviewed all the data. We have various sources of information like seasonal diseases, TB, leprosy, malaria, dengue, non-communicable diseases. There's so much of data, we reviewed it all, and then data triangulation has happened, and then data engineered, cleansed it, filtered it, and processed so as to derive appropriate insights that will in turn help us in making the right decisions. All of this will ultimately help us in making tailored interventions and customized decision making. The dashboard is as follows. Next slide. So this is the Swarna Anantapuram dashboard, where what is shown here is the climatic patterns and the key trends of health indicators. So these are the pregnant women, number of ANC visits done, timely visits percentage done, number of anemic women, and also percentage anemia improved, and the last 2 years maternal deaths recorded. Next slide. This is an interesting correlation between, if you see in the graph below, there is a certain spike in particular months of the year where because vector-borne and water-borne illnesses in that months of the year are rising, and that heat map is the diseases vulnerability of the respective mandals in the district. So this is the spikes we observed in the months of the day. So now we analyze it that this data analysis and evidence based, we can take it a step forward by integrating it with AI powered prediction analysis and understanding and foreseeing the future. Next. So these are the 3 steps, the 3 triangular steps. One is bringing it all together, then virtual PMU, bringing it all together, and AI and ML, risk prediction, then progression tracking, response prediction, predictive modeling, and also flow management. Adopting a life cycle approach, we can do this customized treatment plan. Next. So we have also seen that for all the technology to kick in, we need to plug small loopholes which we have at our ground level staff. One is that they are the ultimately entering data, they are doing it, they are the field level functionaries. So the connectivity, logistics issues, and the capacity building they need, the training we have to impart to them, these are the things that needs to be emphasized, and also awareness and de-siloization between different departments. So sir, I would like to end with a quote of which says that humans have to struggle against exploitation. The real big struggle will be against irrelevance. To keep our PHCs, health and wellness centers ever relevant, data and deep technology should enter into them when the time is right. Thank you, sir.
Sir, Honorable Minister, I hope you're feeling very proud of the Anantapur team because they actually did this in less than 72 hours. Less than 72 hours they put together this dashboard. And Ms. Vinutna only found out maybe 24 hours ago that she was to make this presentation. So we are very proud of Anantapur team and we should be too. I'm told that we have to vacate the stage right now, so that's all the time we have. I'm really sorry. Thank you. Please give a loud round of applause to the panel here.
Thank you, Dr. Angela.
Thank you very much.
And I thank all the panelists. Sorry, if we have more time, a lot of insights would have come, but nevertheless, there is always next time. Thank you very much. Ladies and gentlemen, now we will move into the most exciting session where Honorable Chief Minister would like to interact with participants, key stakeholders. I am sure it would be very, very interesting session because I have conducted a couple of them in Hyderabad. So it would be my pleasure to invite him and Thakkar sir onto the dais. Then this session will be moderated by Shiv Kumar, Chief Executive Officer, founder of Swasti. I request him to come onto the dais. And we have 4 students moving around in the audience who have mics. So you can raise your hand and ask them to give you mic. But please be brief. This is not a speech session. Be quick if you want to have a suggestion or ask a question. Then Honorable Chief Minister would definitely would like to interact with you.
Good afternoon, ladies and gentlemen. Can you hear me in the back? Raise your hands if you can hear me in the back. Put both your hands up. Okay, now clap. I would like you to clap really loudly because we're going to have the Honorable Chief Minister interacting with us shortly.
What is it?
As CM Garu comes onto the stage, I'm going to have a special request because we had a panel which got cancelled earlier, and I'm going to call on those names first for the individuals to speak. Honorable Chief Minister, Chandrababu Naidu Garu and Mr. Thakkar Garu, welcome back to the stage. This is a great opportunity to interact with the audience. Audience, I'm like people say, right? Don't stand in the way between lunch and us. But I'm going to stand in your way. I'm going to help you ask the questions so that CM Garu can respond, or if you have any advice to offer. There are 3 things we're looking from you. One is, do you have a question? Do you have advice for Andhra Pradesh? Do you have a suggestion to make? And I would request you to be very brilliant. What I mean by that is be brief. No more than 10 to 20 seconds, because we would like to, and I'm sure CM Garu would like to hear from all of you who have a point to make, right? There are going to be 4 people, students. Thank you, students, for helping us move around. Can you put your mic up so people can see you? There are 4 students who are helping us. Please give them a round of applause to the students. They will take your points. So the way we will do this is that, as I said, if you have a question, if you have an advice or a suggestion, please make that clear to us. Sure. So the way we are going to do this is that mics don't work in the back. For practical purposes, people who would like to make a suggestion or a question, we would like you to line up in the middle. And I'm going to first call on certain people to come to start the discussions first. Mr. Paneerselvam, Chief Executive, Meitei Startup. Sir, we couldn't hear you in the panel, but we would like your views. If you can come forward, please. And can a mic be organized for Mr. Paneerselvam, please? Mr. Ramprasad, thank you. In your back, sir. Yes, please.
Very good afternoon, and thank you, sir, for this opportunity. I'm the Chief Executive Officer of the MeitY Startup Hub from the Department of Electronics and IT, Government of India. We are an organization, the deep custodians of deep tech startups in the country, and we are very privileged to be part of this conversation. We would have loved to have more time, but three things that I would like to share as part of how we can make Andhra Pradesh. One of the things that we see in the startup ecosystem is essentially a lot of our startups are solving problems for the urban India, and they really don't know, or they are not really aware of the problem statements from the rural part of the. So one of the suggestions that I could suggest is have a problem statement repository by the government, organized by each ministry, centralized, where entrepreneurs, innovators and problem solvers can access these problem statements at a centralized place and pick up problems of their choice and start resolving them. I think that's something which is very, very important and critical. And the second aspect we have is a suggestion we have is we always look at there are only two customer segments for the startups. First is government, second is corporates. And the government is doing their role, and corporates are, a lot of corporates are setting up their corporate accelerators, corporate innovation program. There's a successful program in the central government called IDEX, which is the Defense Innovation Organization, has been running for last 5 to 6 years. And there's a model that almost all ministries can replicate, because they put out problem statements. They have their, one of the mentors from the departments mentoring the startups, hand-holding the entire journey and taking them to a logical conclusion almost for about 2 to 2.5 years' time. And it is a very strategic program that is in nature. And that's a model that most ministries can replicate. And from the Department of Electronics and MeitY, I assure you we will be very happy to partner, and we will share the know-how how we can take it forward from the Andhra Pradesh government side. And the third and the important element is a lot of government focus on funding, which is essentially important. But the truth is, there's more than money that we can give the startups, which is a procurement policy from the startup ecosystem from each of these departments. Because again, it's better to teach them how to fish rather than provide them with a fish. So it's kind of each department can set aside a certain percentage of procurement or from the policy, in terms of that they can need to source this from the startup ecosystem. So these are the things that we really want to look at as suggestions from the startup side. From the Department of Electronics and IT, we are always there to support the government of Andhra Pradesh. And as a CEO of MSH, I'm very glad to see how we can. Andhra Pradesh has a great opportunity to kind of work with us, and we have the opportunity to work with them to kind of drive the startup ecosystem in the state, sir. So it'd be our pleasure to kind of again connect and maybe have a detailed discussion, sir. Thank you.
Thank you, Paneerselvam. CM Garu, one of the things which came in the yesterday's roundtable was that many times startups and medtech people come with a solution looking for a problem. Can the government be very clear, saying these are our problem statements? For example, sir, the Dwakara groups that you started off, can they now move online? Can there be a virtual self-help group? If we can put those problem statements clearly there, I think that makes it easier for the startup world to interact. Over to you, sir.
As rightly mentioned by him, as on today, we are having some problems, but we want to create excellent ecosystem. That's why we brought so many policies now. One is innovation hubs. In innovation hubs, we made 5 zones, 5 innovation hubs. For example, Zone 1, Uttar Andhra, 3 districts. Srikakulam, Visakhapatnam, Vijayanagaram. Then Zone 2, that is East Godavari, West Godavari, Godavari districts. Zone 3, Guntur, Krishna districts. Zone 4, Prakasam, Nellore, Chittur. Fifth zone is Anantapur, Kadapa, Kurnool. 5 zones we have created. We thought this is most viable. Then there will be central hub, that is Amravati, to supervise, to guide them properly, everything. Name also a name, Ratan Tata Innovation Hub. Here, as he rightly mentioned, one is a knowledge economy. And also our program is one family, one entrepreneur. This we wanted to make it reality. Then I have to create the best organization for this total mentoring, venture capital, and how to identify everything in that regard. So we are also discussing with all of you. Ultimately, I told you morning also, as on today, some of the applications we are using. But so many applications we are not using as on today. Either knowledge economy or so many things. I can say how to encourage them continuously. We want to create 500 crores like that. Innovation Hub, Corpus Fund, how to meet all these things. 5 zones, excellent industries who are all located in that zone. One top industry and also other industries present in their area will make it a body. Then academic institutions, these 5 zones, 5 areas we are having excellent academic institutions will integrate. Then we will bring venture capital. We need mentors. That is where other ecosystem also, what all necessary, will do it. Morning also I told very clearly, knowledge economy, sky is the limit, imagination. If you want to achieve all these things, again, in knowledge economy, data is available. As one example, just now my health secretary has given presentation. Ayushman Bharat, we are able to establish reasonably well. We can make it next level. That means 90%, 95%. Data is available. All this data, due to privacy, all these things will mask it, we'll put it before you. You come innovate ideas. Now Kuderu, one case study that is working. Some people have come with a pregnant lady, how to monitor. That is where our Dr. Rakesh has given a presentation morning. So like that, so many use cases are coming. What I wanted to request here, not only here, by seeing all these things, who are all innovators in the state, who are all innovators in the nation, even global innovators, come back with proper use cases. Even technology always, it should be more cost effective. Be clear. This is where I am telling, even if you come with high cost, low productivity, no result, less results, then it may not be sustainable. That if you can come, morning also, our minister also has told very clearly, we will create an organization. How to single window, all your use cases, you can come to that organization. Respective departments, they will coordinate. Your use cases are useful, straight away they will use it. And at the same time, proof of concept. First they will use it, pilot, automatically it is very good, then we'll replicate, then we'll give you results, then proof of concept will establish, then you can go to national level, international level for your product launching. This is where I am saying from the beginning. Today, not only one thing, what all we are thinking here, somebody already in advanced stage. So many brains are working globally. So early is the best way. Very soon I am hearing all these things from you. Very soon we are going to establish that type of ecosystem in Andhra Pradesh. Then trial and error will work continuously. Ultimate aim is I wanted to make Andhra Pradesh a hub for knowledge economy, number one. Number two, every family, one entrepreneur. That is our mission. We will work together. And also innovators, I am appealing all of you. Recently we had a drone conference. Nobody visualized the importance of drones. Excellent use cases have come. Even some of the use cases I am shocked to hear, they are from remote area. Imagination, even they didn't have proper educational background also they are innovating. Even intermediate students. Even Srikakulam remote area, people have come. And also by always one, if you see, all innovations were done not universities, sometimes outside universities. Not best graduates, even illiterates, dropouts. Even Bill Gates also drop out. This is where things are happening. So we'll work together. This is the, I'm very happy, everything we will publicize. You need not go to anywhere. There will be clear portal, committee, use cases, they will talk to you, we will adopt straight away, and then we'll give you proof of concept. We'll do it. Thank you.
Thank you, sir. Sir, yesterday we had around 150 people in the room. Tucker sir and Kutumbarao Garu was also interacting. Two problems came up, sir. One is government's ability to transparently procure medtech or any other tech in a way that we get it at the right price. As you rightly said, technology should not be expensive. It should actually reduce cost. So we need a policy and a system which enables procurement by the government to happen smoothly. And one big challenge, sir, given the rate at which the technology is growing, sometimes our capacity to even understand the speed at which it is going may stop our ability to evaluate a technology. So any thoughts, sir, how a government can build an ecosystem as you're envisioning, which involves both being ahead, but at the same time being transparent?
No, we'll do one thing. Even I can take associations or experts from outside, and also government people. Ultimately, government is supreme. It is a sovereign power. You have to accept, but sometimes you are having reservations. Government means it won't work. It will create problems. There will be hurdles. That is where we are thinking why people are going to Silicon Valley and launching the projects. There is a proper environment. Even in the morning I have seen some presentations. Same time South Korea or some other countries have started economic development. They have reached new heights. But India is moving lot of potential, hidden potential. We are unable to expose all these things. But ultimately anything government has to promote. That is where Hyderabad success story. In the initial stage, small problems will be there. We will create a best ecosystem to take forward. I am assuring you, without having any bottleneck, I want to promote entrepreneurs in a big way. For this, we are streamlining total administration, and also it will be responsive. And at the same time, I will involve associations and also experts. from private sector also.
Sure.
We will work together.
Thank you.
Even always startup companies, out of 4 or 5, every startup may not be successful. We are seeing. But we should not discourage. Continuously, sometimes 1 or 2 failures also, we must be in a position to absorb and encourage further. That also we are keeping in our policy. We will work it out.
Thank you. Thank you so much, sir. And we have a big round of applause for that, please. This is one of the most encouraging things, sir, because without that ecosystem, the private sector also cannot interact, but government also can't get the best out of the industry. Sir, with your permission, I would like to call on Mr. Manish Gupta from SAP. Manish has come all the way, and he's from one of the most leading companies. Manish, over to you, please.
So my latest and greatest qualification, sir, is I am a father to 2 daughters. One is 11 and one is 6 years old. Both of them go to Blue Blocks Montessori in Hyderabad for last 8 years. And we were having a conversation last week, and one of them, the elder one, says that she wants to train and she wants to help the rural children by staying in Hyderabad so that the rural children or the rural society can earn their pocket money. My elder daughter is very good in origami, which is a paper crafts, and that initiated the thought in mind how we can actually utilize everybody who knows something in this state or in this country, that each one skill one, right? I will skill somebody, everybody present in this room will skill somebody. That's one of the thoughts. I'll take this back to my daughter and say I was able to bring this point to you. The second point, sir, is while terrestrial, we are doing a lot of interesting things in the state, in the country. It's nice to have the eyes in the sky, right? There are a lot of private companies which are sending CubeSats to space, in the low Earth orbiting space. And some of these can be used by the state machinery, by GFST, to identify a lot of interesting use cases. One is disaster management, the other is land monitoring. So once you have eyes in the skies, 250 kilometers up, there is so much possibility to do so many interesting things. I know one of such startups who would be willing to explore some of these interesting use cases. I cannot comment on the commercial part of it, but at least something very interesting that can be brought up. The third thing was, sir, since I come from a technology company called SAP, we work very closely with enterprises. And I think government should also be treated like an enterprise. You earn money, you spend money, and there's an entire machinery which works. And if all the systems that are deployed connect to each other in a recent way, then what stops Andhra Pradesh government to function like a Tata Motors or a Tata Projects Limited, where everybody has the right insights, he knows what to be done, and they're getting the best service out. In this case, the customer is the citizen, right? The second last point was, sir, is the last mile is a big challenge because the government can have as only about this many people, and we have a large population in the country as well as in the state. There is one interesting concept of resident welfare associations. Now, interestingly, they are all registered bodies, and all the members are elected members. The housing committees, everybody comes together and elects those members. Can these RWAs become an extension or a quasi-government extension to the localities where they can help in the locality development, problem solving, etc. And fifth one is, my question to you, sir, is why is governance needed? Governance should be working automatically. The day I am born to the day I die, everything should happen on its own. And if that happens, with your vision of speed of doing business can happen on its own. Thank you, sir.
Thank you, Manish.
Last point, I'm assuring you, it will happen very soon.
Thank you. I can see that.
That means we are starting now WhatsApp governance. Government always wanted to control. As a matter of fact, we want to facilitate. We are forgetting facilitator role, then we are entering to controller role. For example, as you rightly mentioned, only human beings born only once and also die once. For these two things, MRO is going to update continuously with his discretion. What is the fun? I don't understand. Once he was born, it is noted, automatically anybody will come, date of birth has to give automatically, wherever he is. Nativity cannot be changed, caste cannot be changed.
Correct.
Percentage of schools or certificates, college certificate marks cannot be changed.
I agree.
All these things you have to go to pillar to post every year. Very soon you are going to see you need not go to anywhere. All these things you can download anywhere in the world at your convenience whenever you require. Not only this, more than 100 or gradually I am making everything seamless. You can take services, power bill you can pay automatically, electricity bill or something, everything. Even if you want to go to any temple, you can reserve a ticket. By the time you can go and have darshan and then come back. All services I wanted to provide in a big way. We have started. That is where morning I told you very clearly. One is Aadhaar. It is a very good advantage for India. Second is your telephone. Now, OTP, all these things are coming. Now every family, every member, wherever you go, airport also, no need to have your passport or your ticket, all these things. Directly you can enter and go. What more evidence you need? So I wanted to move in that direction. One is individual, Aadhaar, bring them as a family, who are all in the family, then GPS, then everything will be authenticated. I will know what are all the requirements for each citizen, each family. Either house, outside or some other else, everything will make it. Finally, we are planning in such a way.
All the best.
We'll work it out.
Thank you very much.
Thank you, sir. Thank you so much, sir. May I, in that light, there are over 3,000 schemes and programs for the poor. Some of them are central schemes, some of them are Andhra schemes. And when we mapped it out, one of the things which came out is, as you were saying, deserving people, if the scheme is there, they should receive it. But there is an application process, there is a documentation process. Can we move one step further, sir? We have the DigiLocker concept. Can the DigiLocker, if all the documents are available, right? And if the family is eligible for certain things and they don't have it, is it possible to automate it slowly over a period of time?
That is what we are working as on now.
Okay.
As a family, what are all the schemes is eligible? As a family, what is the economic status? What is the skill or potential of that family? In a family, 5 members, all are not equal. One family member is having more IQ or advantages or skills, everything. So I wanted to plan everything. Individual identity, family as a security. Both will integrate. Automatically we can synchronize all programs with that family is eligible, and then we will apply for them.
Wonderful.
All of a sudden we may not do it, but minimum programs we have to target all families.
Right. Thank you, sir.
There is pension, there is ration, there is health, all these things, everybody is eligible.
Eligible.
Some programs, those who are all, that is where I told you, zero poverty P4. There I will focus more on last mile. Then they will bring them. For others we may not bring, but at least we will uplift. Sure. Continuous process. That is where we are doing. As I rightly mentioned, all programs I want to synchronize. Still there is a problem of literacy. Common man in the village may not understand, but our secretariat in the last mile, they have to coordinate, we will coordinate.
Sure. Thank you, sir. Thank you. Can I see some hands up, questions? Okay. You will need to move forward and take the mic. And while we do that, do we have Rohit from the Piramal Foundation here? Rohit? Rohit, can you come forward, please? This is a subject which you are very familiar with. So we have from Piramal Foundation, Rohit, who's done some amazing work on digital governance. And Rohit, if you can talk quickly to CM Garu about your entire DigiLocker approach and how it can be done. Then we will, ma'am, you go ahead first, please.
Sir, I'm Lakshmi, speech language pathologist and audiologist.
Mike Neera.
I'm Lakshmi, speech language pathologist and audiologist. Here I've been hearing from past 2-3 hours about technology and healthcare. But as a speech therapist, every day I'm seeing around 10 to 16 children who are having autism, mental retardation, misarticulation. They're not able to pronounce even a simple word properly. So all this is sometimes because of electronic gadgets mothers are giving right at the early age, and about very poor awareness about speech and hearing issues, about communication issues in the health sector. So what we thought was earlier, I have a Vishaka Speech and Hearing Center from past 20 years. Earlier we used to have an Institute of Speech and Hearing in Hyderabad. But after bifurcation of the state, whole of Andhra, we don't have a speech and hearing college itself. So hardly we have 100, we have an association called Andhra Pradesh Speech and Hearing Association. The whole of Andhra Pradesh Association, we have 20 to 30 speech and hearing professionals who cannot service or give awareness to all these people of our population. So we initiated permission from Andhra Pradesh to start a speech and hearing college. The problem here is we do not have faculty. So they keep asking for where is the faculty, how can you educate the bachelor's or diploma course students if they come for.
Sure.
So we would like to ask, in case if we can have virtual lectures from all over the world, even from Basel University we have people coming here who are pioneers of this speech and hearing communication disorders. Until we have this virtual permission to implement in colleges like us. See, ours is a very small firm. Vishaka Speech and Hearing is hardly 20 years young. To get permission, we have to go to Rehabilitation of Council of India in Delhi.
Ma'am,
So they have particular steps.
you're asked, what is asked for you?
Yeah, so what we wanted to ask is their permission they will give only for the faculty. But in case if you can help us with a virtual permission to get lectures from online, then we can have multiple, by 1 year we can have 20 speech and hearing professionals developed in this state.
Right.
So every year we can develop so many speech and hearing professionals and help our future children who will not have any communication or speech and hearing problems.
Thank you.
Thank you, sir.
What about our Secretary
Krishnababu Garu,
Krishna Babu? You will answer.
Sir, Elite Council actually, RCI mandates physical lectures, sir, availability of physical lectures, sir. We will just check up, sir, and whether that kind of faculty is available or not. Otherwise,
What our suggestion is, we will have one college,
yes,
both virtual, physical, integration of lectures globally, and also continuously we will train our people. That is one. Second one, Government of India permissions. How to get it single window? Can we get it?
Yes.
Simple question.
RCA has to give NOC, sir. She has already applied. We will follow it up.
Not individual case. I'm not bothered about, she brought a problem.
Yes.
How to make it effective implementation, free for all, but no children in Andhra Pradesh should suffer because of that, lack of infrastructure. How to do it, you tell us. You get
We
it
will
done.
work together, sir.
You
actually.
take suggestions and get it done.
Yes, I have taken number, sir, her number. So we will work together. Sir.
How many students are there in Andhra Pradesh, everything. How many children?
Yes, sir.
Okay. You give the details, we'll get it done.
Thank you.
Okay.
Thank you. Sir, your point is that estimate the total number of children, how many people we need, and solve it at a system level. Done, sir. Sir, I would like to invite Rohit very briefly. I would request all speakers to be very brief. Rohit, if you can share the Digital Bharat Collective work, and if you have any ask from CM, sir.
Sure. Thank you, sir. Sir, myself Rohit from Piramal Foundation, and we have an initiative called Digital Bharat Collaborative. Under that, we are committed to strengthen the health system in the states. We have piloted our programs in Bihar and UP in collaboration with the state government, wherein the command and control center at the state level is formed, which was inaugurated by the CMs of the respective states, whereby we could able to really monitor and govern the programs, health programs from the state, as well as from the districts with the different district magistrates. We could able to establish the review mechanism over there, and in the block we could able to help to the officials in creating the differential planning for improving the indicators of the health in the block. And finally, with the frontline workers, we've been helping them to really build their capabilities in managing her work. So this work has been done extensively from last 4 years with the states, where we started building the blocks from creating the digital architecture in the states, as well as governance mechanism in the state. I'm hoping that with this learning, if we can able to also come to Andhra Pradesh and can able to contribute also into the development of part.
Thank you.
So what is your suggestion ultimately?
So, suggestion is that at the state, one of the learning for us was that there is a lot of, as sir was also saying, we have a lot of data, but where is this data all going to? Is this data actually used to drive the programs for better? I think if we can able to at all level able to create the right information to the right person at right time to drive the right decision, we can able to solve this at a better way. And in the state, if we can have this command and control center which can have a surveillance of the facilities.
What is your expertise? What is the product you are having on that?
So at every level, we can able to help in the creating governance mechanism and deploy the digital solutions. And with the youth, we have almost like 600 fellows working with us which are between the age group of 20 to 26. They are the one who is doing the change management on the ground.
Right.
And these are the people who actually passed out from the IITs and good colleges of India, 100 top colleges of India. They actually go and stay in the villages, work with the community, support the system in establishing the change management and deployment and adoption of the programs.
So Rohit, if I may help you reframe, sir, I think the work they have done in UP and Bihar is they built multi-level dashboards using government data, and they also mobilize the youth to verify the data, and multi-level governance has become possible, and that's a solution they are willing to offer to Andhra Pradesh.
What I am thinking, we are also working everything systematically, all departments, and also I told you, as on today, governments are using data standalone systems. Because of that, we are having a problem of comparison, all these things. Now I am bringing uniformity. If he is having any ideas how to integrate, we will be very happy to associate with him.
Sure.
Even not only Andhra Pradesh, even I am integrating with the government of India, Ayushman Bharat, APAR, all these things. That data also I am integrating. So that single source of truth, so that decision making will be very easy. Or otherwise multiple channels again will have a problem.
Absolutely.
If he is having good ideas, we will sit with you. Even we are using all knowledge available for overall improvement of the society, either health, agriculture, all departments of the matter.
Thank you, sir. And like Krishna Babu Garu is already doing, he is integrating multiple department data for health.
Yeah, we will do that. I am telling you government approach, very clear. As on today, historical information we are having, some of the departments, but stand alone. Pensions, one format, one department. Health is different. Or ration is different. Like there are so many departments, so many ways we are using. Now I am bringing one citizen, all services, one family. This is the concept we are working. Historical data we are having, dynamic data we are collecting through Ayushman Bharat. Every day somebody is going to doctor, he will treat, he will update data, that type of data. Second, through IoT's data or CCTV camera data, or tomorrow drones I'm sending that data, every data. By using all these things, then I want to go artificial intelligence and also predictive analytics, finally ML, AL, anything for a matter, then deep technology.
Right.
Ultimately, I want to provide best solution for the problem without confusing anybody. That is where nowhere in the country as on today, governments have done. First time I am approaching integrating with all the data. Truth is one. The truth, how to bring it, individual, family, on various problems. It may be health, education, skill, agriculture, anything for that matter. All layers we are building.
Right.
There, if you can come, any ideas, we will be very happy to associate with you.
Thank you, sir. Thank you very much, sir. With your permission, somebody has traveled a long way to meet you, son of the soil. Principal Secretary from Meghalaya, Mr. Sampath Kumar is here. I would like to invite him to come on board and share with us his thoughts. He's put a lot of thought about Andhra, what needs to be done.
They are doing some work.
Thank you, sir. So, sir, first of all, I would like to thank you, sir. In fact, you provide a very inspiring and exemplary leadership for the whole country. In fact, so one thing, sir, I would like to tell about a use case. You asked about use cases. Sir, Meghalaya is a small state, but a very difficult state, sir. So for last over 5 years, we have been working on one model, sir, based on what you said, population management. Sir, maybe I just like, if you look at, sir, in India, average below 18 years, about 35% of the population, sir. Meghalaya, we have about 49%. So basically what you just said, sir, we have a demographic dividend, but are we actually unleashing that potential of the demographic dividend? So when we look at the indicators, sir, like if you look at, sir, we have 35% stunted population. Stunted population means their brain cognitive capacity is not fully developed. Similarly, we have look at the data, like class 5 students cannot actually apply the numbers. Class 5 students cannot simply comprehend. So there are almost like 45 to 55% students are not able to achieve that learning outcome. So investing on people is a great idea, sir, what you are saying. So what we did, sir, we created a human development pyramid based on the brain science. So brain science says, sir, in first 5 years, actually we in fact 90% of the brain develops. So in fact, if you see one Harvard Center for Developing Child, the graph, I think maybe you can show it late, next slide. So what happens, sir? I would like, maybe you can see, this is the kind of a thing, sir, maybe just a slide that we have shown. So this one, sir, the brain capacity, the neuroplasticity we call it, it's very high during the first early childhood development period. And the second opportunity is adolescent development period. So if we invest in during these two periods, we get actually phenomenal results. There is a study done in US, the Perry School project, which shows that, in fact, the Nobel Prize winner, he had proven that for every dollar we invest, we get almost like 17 times return on investment. So investing to do that one, sir, what we did, we formed a Human Development Council headed by the Chief Minister, sir, and then integrated all the departments and prioritized all our actions towards unleashing that potential. So even training the parents how to do positive parenting, how not to do in altercations or anything before the children so that it will affect their brain. So such kind of a very intensive exercise we are doing. So actually we have set up a government innovation lab in Meghalaya. In fact, our Honorable Chief Minister also, like you, sir, he is also very innovative Chief Minister. We all wanted to come and sign a MOU with the government of AP. And in fact, bring a lot of these ideas. In fact, we are learning from the state of AP. We have taken our CRPs from here to Meghalaya, who are teaching us natural farming. So what you said, sir, knowledge economy or knowledge, you wanted to make it. I think the sharing of the knowledge and, sir, the ideas would be very helpful. We would like to, in fact, put forward this idea before you. But thank you, sir, for all your inspiration.
Now, what is your, when you started this project, how much time, what is the outcome?
Sir, actually we started this entire idea, we started during the COVID, sir. COVID gave us a lot of opportunity for us to really deeply think. So the outcomes, sir, actually would like to show, this actually, sir, this is a project, but I would like to show there is a 50% reduction in the maternal mortality rate, sir, in the state, which is the sharpest decline anywhere in the world. In fact, which has been, sir, actually now Harvard University is actually taking it as one of the cases to teach as part of their courses. So that's the kind of a result, sir. So basically, in fact, ADB, I think Dr. Dinesh Arora spoke to you, World Bank, they're all working with us, sir, basically investing at different life stages. Maybe investing on people like Gurujada Apparagar Chepinattu, sir, like maybe like Desamente Mattikadu, Desamente Manishiloi. I think, sir, the way you just mentioned population management is so important. Otherwise, the replacement rate is coming down. Definitely, sir, I think we need to unleash that complete demographic dividends. Thank you.
One is the demographic advantage. You are able to do population management also simultaneously?
Yes, sir. Sir, because, sir, to unleash that early childhood development period, one has to give a lot of time, sir, actually. So basically on children, so parents, schools, Anganwadi workers, self-help groups, everyone has to give time, sir.
No, I can understand. I am asking straight question. One is, that is a very good thing, awareness building, everything you have done, council, all these things, structure. But what is the population replacement level in your state?
Sir, ours is actually, sir, we are actually, in fact, number 2 in the country, sir. 2.9 is our total fertility rate.
2.9?
We actually will going to be the number 1 in NFHS 6, sir. So we are basically, we don't actually, sir, we actually only say spacing. We don't, because we don't actually talk about, in fact, we spacing so that there is a better maternal health, as in fact, one of the speaker was mentioning, sir, actually how to really teach those things, to entire.
You give all the details.
Yes.
What is your success story?
Yes.
We are having some success stories. We will work together.
Okay.
Meghalaya government and Andhra Pradesh government can work together.
Thank
I will be very happy.
Thank you so much, sir.
Thank you. Thank you.
Sir, if I remember right, I think in your time, water mission you set up so long back. You brought together 17 departments. I think the idea is very similar, sir. Setting up a human development, this thing, and having that focus. That
is a good concept. We will work it out.
Sir, I want to say something in relation to health, because I've been hearing so many. So, about 14 years back, we started health centers in addition to our business in memory of my parents. So, we started in all small districts like Srikakulam, Narsipatnam, Gajuwaka, Bhimili, and my village, opposite NTR's village, Nimakuru. So, we are now able to serve every single day 1,800 to 2,000 poor patients, and in a month 50,000, annually 500,000 people. And this is happening for the past 15 years. What do? We have all diagnostic tests, including X-rays, blood tests, ultrasound. There are about 70 doctors working in all these 10 centers, and they are paid less, retired people, ESI, government doctors. Directly we are able to feed into the mouth of each patient. And Jeevandhara Pharmacy giving medicines at 80% discount, cost charging them 20%. So just to give you an example, consultation fee of a doctor is 20 rupees.
Sir, suggestion please, straight, if you don't mind. Sorry. If you can come to the suggestion, what you have.
Yeah, suggestion. So the solid work is going on, actual solid work at the ground level. I would urge you to depute somebody, look at our Varun medical centers, not anything hi-fi, but the solid work is going on. Lots of poor people are being helped. And a lot of people who are sitting here, they all know about it because they have been sending their drivers. And the second thing is, we are running skill development centers, 8 of them. So about 1,000 boys and girls prepared for denting, painting, air conditioning. So when we have one side unemployment, the other side, there are people are not available with skills. So from that direction, because we employ a lot of people, so we are preparing 1,000 boys and girls. So why don't you have somebody visit our skill development centers and medical centers? People like us, there are so many entrepreneurs. Each district, if you can ask 4 of us to start 5 or 10, your basic problem is solved. You can capture all these typhoids, blood problems at the beginning before they accelerate to a bigger disease.
Thank you.
We are actually doing groundwork.
Thank you.
We'll work it out. We'll ask our people
Know
to
about it, but
you get all the details. We'll encourage others. In skill development also, we'll send our team to study.
Yes, ma'am.
Congratulations to Great Dias. It's not just
దగ్గర పెట్టుకోమా మైక్ దగ్గర పెట్టు
sustainable transformation Dias, but it's a Dias to extract the intellectual wisdom and wealth from the next generation. And I'm requesting the Great Dias to create virtual and physical governance, research and development, holistic research and development template. Unless we create a just major template, the template, like with reference to deep tech, like the AI template, with that the AI template, we can connect sub-AI levels. At the same time, before going to all these dynamic structures and template of the governance, which is connected to virtual and physical Dias of the governance, we need to work especially on environment. And always you're telling, sir, I'm a student of you from the beginning. Since my student days as union representative, I know that. So I interacted you. From the beginning, you're also very concerned to environment. So nowadays, in India, what I experienced, I can't walk even a kilometer or half a kilometer on the roads. Because we are not only in just urgency of the work referring to environment, but it's emergency. Unless we work towards environment maintenance and cleaning and just management, we can if you initiate, so your Dias is not a just political Dias, it's not a governance Dias, it's a service Dias. And your forum, with intellectual forum, concerned about the government of the people of India through P4 policies, so we can work first through environment issues. Right. So eco-friendly approaches, and you can collaborate. You are the right persons with the help of our national leader, Prime Minister Modi, and you, the Great Dias, can collaborate, can initiate, can take all the people, irrespective of any discrimination,
Madam.
Industry, people, public, private, all the stakeholders. So
Madam,
can do
you.
wonders. For this, I have a strategy. So I'm requesting you, sir, to initiate environmental program through Great Dias.
Thank you.
Thank you, sir.
Thank you so much.
మీరు చెప్పినట్టు వీఆర్ వర్కింగ్ ఇన్ ఎ బిగ్ వే. స్వచ్ఛ భారత్ ఈజ్ వన్. గవర్నమెంట్ ఆఫ్ ఇండియా has created a department itself. Overall comprehensive idea of Swachh Bharat, we are having Swachh Andhra Pradesh. We will take up this issue as a campaign mode. For the last 5 years, if you see in Andhra Pradesh, even garbage is totally, they are unable to lift also. Legacy garbage, nearly 85 lakh metric tons are available in Andhra Pradesh. That is a big challenge for us. Long back we started from waste to energy, waste to compost, everything. Again, we will work on environment front, how to improve greenery, forests, how to make it clean, everything. All people has to join together. Ultimately, we have to create a legacy on environment. We have to tell proudly, this is what we have achieved. There is a contribution from every individual regarding environment protection, then only it will happen. We will work it out. We will come back with clear-cut milestones and involvement of every citizen in the state. We will do it.
Thank you, sir. So this is the last question. Last question, please. I know there are a lot of people queuing up for questions. Real apologies. CM sir's time is very less, and this will be the last question, please.
Good evening, sir. Thank you very much for this wonderful program. I wanted all of the members to know, I was interacting with 2 startups in the morning, sir. So how we can take them forward. One was RapidX. I would request, the suggestion would be to make them involved in all the blood banks. What they are doing, sir, if you take a blood sample, when you take blood out, we only test for hemoglobin. 90% of the women are hemoglobin deficient, sir. But this instrument is telling which type of anemia. They're also testing for malaria, and the beauty is they're testing for cancer screening also, sir. And they're not charging, it's only a monthly charge of 5,000. So if we make it, that startup's name is RapidX, they have deployed, yesterday I spoke to them. If we can mandatory for all the blood banks to have that equipment, the advantage would be, sir, everybody donating blood would be screened for blood cancer also, would be screened for malaria also, and for which type of anemia also. All those things are not happening now. So that we will be the first state in the country where a donor will have access to all these facilities free of cost. That is one suggestion, sir. There's another startup from Nipun Sahani, son of Mr. Ajay Sahani. They were testing for viral infections, and their test was costing only 100 rupees compared to a 2,000 or 3,000 rupees, which took 7 days. They're testing in 10 minutes, and they're requested for doing it in KGH. So if we could facilitate these things, I think the outcome of this conference will be directly available to the public. They will really see for themselves how many people are benefiting this great initiative. The last suggestion I have, sir, you were talking about the data available with all the government institutes, government hospitals. Data is gold nowadays, sir. If we can randomize the data and people who are doing research in AI can actually access this data, if there is a platform where they don't need to run anywhere, it is clearly available that they can access this randomized data without the name of the person. That will fetch a lot of revenue. We can monetize this data to earn gold, sir. So there should be, the suggestion is to create a mechanism where randomized data of all the patients is available for research companies where the government can earn money. And the last suggestion, sir, one last suggestion, sir. The previous government had 17 medical colleges, sir, and you see that infrastructure also is not built. All the medical colleges in Andhra Pradesh, sir, the entire infrastructure is free after 5 p.m., sir. So my request is, instead of starting a new medical college, if we can just appoint new faculty in the evening, we can have double the medical college in every medical college in Andhra Pradesh.
Thank you.
That's the only suggestion I have. Thank you very much, sir.
ఓకే మా వెల్ టేకన్. మీరు చెప్పినట్టన్నీ కూడా ఆల్రెడీ స్టార్ట్ చేశాం. ఈరోజు మార్నింగ్ వాళ్ళు ఇచ్చిన చూశాను నేను, సహాని వాళ్ళు కూడా తయారు చేసింది. ఆల్ యూస్ కేసెస్ విచ్ ఆర్ యూస్ఫుల్ విల్ లాంచ్ ఇమీడియట్లీ. దెన్ విల్ సీ ది రిజల్ట్స్. I am assuring you very soon we are going to create a body also, one committee to select all these things. Across the department, single agency will do all these things. That is one. Second one, as you rightly mentioned, all the data, not only monetization for the government. I want to go for startup companies to use this data and create use cases. Again, they can come back. We will use that. Then proof of concept is right with accuracy. We will certify them. Then they can scale it up commercially. Nice. That also will encourage. This is where from the morning I am hearing all of you. Detailed way we are going to check out a program. Already we are having clarity. We will improve further. We will put it for public consumption and public utility. Basing on that, once in 3 months, we will have similar sessions, computation, everything. We will review continuously till we reach reasonable level.
Right.
That is what I am thinking. We will work it out.
Thank you, sir.
Anything?
Sir, there are a lot of people waiting, sir, but time is less.
What is that, youngster? What is your suggestion? Carry on. Come.
Good evening, sir. Actually, most of the delegates who are most senior leaders and innovators, they got the chance to question. I am a third-year student. As a young entrepreneur, I just have a question. Mine is an AI-based startup in software as a service and product. We are making augmented reality smart glasses for blind, deaf, and mute, sir. And after seeing your in your assembly where you have spoken, you have shown your ring. So I thought of to get a chance to demonstrate myself here. So past 8 months I have been trying in 3 governments, that is Madhya Pradesh, Gujarat and Telangana government, to incubate my own startup, which is not being possible. So with this smart glasses, with the wearable ecosystem, which is being available at low cost, our goal is to give a facility which is being given to the richest person. Same facilities need to be given to the poor. So we are delivering it in a low cost. So
what is the product?
Augmented reality smart glasses for blind, deaf and mute people. So how the Andhra Pradesh government can assist me in incubating my own startup here?
Okay, you be in touch with him. We will work it out, but we will structure it. People like you how to go about. That is where I told you tomorrow there will be incubation hub in Visakhapatnam itself. You can go straightly. Then they will handhold, they will guide you, they will mentor you, they will launch you, and then they will take to the logical conclusion.
Thank you so much.
We'll work it out.
Sir, one very last question from my side. In your first term in the undivided Andhra Pradesh, you were worried about malarial deaths and you started reviewing the program very hard. And at that time, around 10,000 deaths were there roughly. And it started going down very, very rapidly once you started reviewing the program. But then we also saw data which showed deaths due to unknown reasons going up very strongly. It could well be that they were classifying it as unknown because CM Garu is reviewing it. So one last question to you is that are you worried with the way data, tech and AI trends? Which are the worries for you, which is keeping you up in the night? Just the last question, sir.
Follow your question. Can you repeat?
Are you worried about how the data and tech can also be manipulated, can also become a problem rather than only a solution?
No, from the beginning I am telling you very clearly. In computer you feed garbage. Garbage only will come out as outcome. I am very clear on that. So data scrutiny, corrections, updation, it should be 100% foolproof, then only we will get 100% perfect information. For that, checks and cross-checks, everything we have to follow. Even recently, one example I am giving you, how computers are very dangerous. Land records. Government has wanted to they are saying we are computerizing your records. Then there is a clause 22A. Once if you add 22A, it is government land. If you delete 22A, it is private land. Then what they have done cleverly, they added 22A. Manipulation. Then people will be, automatically that middleman or broker will come, your land you give it to me. If you won't give it to me, then it is 22A, it is government land. Then you face the music. Then that fellow, poor fellow, where he will go? Naturally he is surrendered. Some people have compromised, throwaway price they have given. Again one word, 22A, they deleted. Then automatically land is valid, private land. That type of manipulations is very dangerous in computerization. That is where Government of India, Aadhaar is 100% foolproof. Our digital currency is working very well. 40% transactions globally we are doing. Still, cyber security is a threat.
Sure. Thank you.
I have given digital currency report. At that time, I used to call everybody, Reserve Bank, bankers, even service providers, even technology persons, everybody. I used to ask them only one question. What is the security? Is it 100% foolproof? Nobody told me it is 100% foolproof. Always technology, some fraudulent fellow is more efficient than you, is more innovator, then you will break your program.
Yeah.
That is the biggest danger. But at the same time, governments, regulatory agencies has to be very clear. We have to control. Data, I am assuring you, what we are going to get 100% foolproof data, nobody can tamper. And also, on the base of that, I want to take decisions. And checks and balances, passwords, everything, what are all the security we can keep, everything we will keep.
Wonderful.
You can rely on government data in course of time. We will purify everything, every data, single source of truth. This record is there, it is 100% foolproof, that is our sovereign guarantee. I am telling you, I am assuring you that stage we are going to reach very soon.
Thank you, sir. Thank you very much. CM Garu has spent almost an hour listening. I know some of you are waiting for questions. Our sincere apologies. We will now go into for MOU signing, and then the rest of the speakers will come later after that. So those of you who had questions further, our sincere apologies. We are not able to cover all of them. Sir, thank you very much. A big round of applause to CM Garu for his time.
Now, one question I want to ask all of you, because you are all intellectuals and also technical people, some people are interested in technology, all these things. This type of conferences are useful in course of time? If it is useful, can you raise your hand? Okay, that's good. Yeah, I will make it department-wise and also integrate technologies, everything use cases. Ultimately, data where you are going to get, that is one issue. Either drone or CCTV camera or otherwise your cell phone or your satellite or sensors. That is your innovation. Ultimately, I need use cases in government and public use cases. We will promote all these things. Department-wise, we will have some special sessions where you can exchange with them and then you can provide some services to them. We will work it out. No, that is again, it is a legacy problem. We are overcoming all legacy. Even I am working one more thing. Tomorrow for all incentives, I want to start escrow account. Immediately, whenever you complete the work, it will come automatically. Nobody can change in future. I am thinking that also, escrow account. I will open. Biotech hub we will keep. Long back I have started that Genome Valley, Hyderabad. Again I am thinking seriously, here biotechnology. Yeah, we'll make it. One of them, either Anantapur or Uttarandhra, will make it.
Thank you, CM sir. Now quickly, I request Honorable CM sir and CS sir to be on the dais. I request Sanjay Gupta ji, our CEO, to be present on the dais. We have 7 MOUs between GFST and different organizations and also with Government of AP. I request all the concerned people to be readily available so that we can finish them quick succession. The first MOU is between GFST and Samagra. I request Mr. Gaurav Goyal, CEO and MD of Samagra, to come onto the dais, please. So these MOUs are basically for project monitoring, institutional support and studies. Now next MOUs are between GFST and GAME, Mr. Ketul Acharya, President, and Mr. Mekin Maheshwari, Founder. I request both of them to be quickly come onto the dais, please. Then next MOU is GFST and German University. Mr. Raz, please. Mr. Raz. Mr. Raz from German University. Yes. नाम पढ़ने के बाद देखो. नाम पढ़ने के बाद. इसके बाद next. Doing it, sir. He is talking. German. జిఓఐపి అని ఒకసారి చదువుతాను. నా కంఫర్ట్లో నేను చదువుతున్నాను సార్. గేమ్ అయిపోయింది. గేమ్ సరే. జిఎస్ఆర్ ఫ్లూయెంట్ గ్రేట్ జిఓఐపి ఈస్ దేర్. యూ దేర్ అంటే So with German University, request Mr. Raj to be on the dais quickly, please. The next MOU will be with between GFST and Fluent Grid. Dr. Murali, please. Next MOU between JFST and GSR, Dr. Srinivas Gosala. Then the next two MOUs are between Government of AP, one is with CMS. I request Mr. Bokati Karuna, IAS Commissioner, Health and Family, and from CMS, Mr. Shivkumar, Founder. I request the entire GFST team and event management team to quickly come for a picture with the Honorable Chief Minister. Request all the GFST team. Ramnath Garu, Ramshavrao Garu, Raju, please quickly come.
You gotta put your past behind you. Look, kid, bad things happen, and you can't do anything about it, right? Wrong. When the world turns its back on you, you turn your back on them. That's not what I was told. And maybe you need a new lesson. Repeat after me. Hakuna Matata. Hakuna Matata. It means no worries. Repeat after me. Hakuna Matata. Hakuna Matata. It means no worries.
Thank you very much for spending time with us, sharing your thoughts, perspectives, and also all the sponsors who supported this event. I thank Novotel for the hospitality. We have coffee tea going outside. I request all of you to go and have refreshments and then have a safe journey back home. Thank you very much. We will soon IIT University and some students also can come and have the lectures. Our Chief Minister. Please come to the students.